My name is Jessie Smith. I am the Director of Therapy here at Neural Effects. My background is a bachelor's degree in sports medicine from Brigham Young University. Neural Effects is amazing. What we're doing here is treating acute concussions. So any head injury, hitting it on the corner of a TV or your car, to a major car accident, or anything in between. There's a wide range of things. That's what we do here. We treat them and we use therapies from exercise therapy to exercise and cognition and balance and vision and vestibular and all kinds of things that we do here together to really treat the whole patient as opposed to just one part of it. That's actually a big deal in the medical field right now, is that one person will diagnose and then he'll send it there and say, I'm gonna define this, but I'm not gonna treat it, and I'm gonna send you here, and then that person gets sent somewhere else and somewhere else and somewhere else, and it just becomes very difficult for a patient to manage. And here we like to keep everything coordinated. Most people have a hard time with the medical field in general because of that, and we don't want you to have to regulate that, especially when you're in a concussed state. Like, that's hard. So we do the diagnostics and all of the testing and all the everything here. We do therapy in-house. To be totally honest, most of the clinics in the country do a one-size-fits-all. It's see how you're doing, rest, come back in 2 weeks, and let's see how you're doing. All right, you're not better? Oh, you must need more rest. Do it again. And that's about it. Or, oh, your eyes hurt? Oh, maybe you can go see a vision therapist. When some of it falls outside of my scope, and I'm perfectly happy to recognize when it does, we do have specialists that we refer to and or bring into our office to help us. The cool thing about working for ourselves is that we get to decide what to do. We have the ability to make the decisions and choices that we want to because we're a private clinic. The other guys are trying to do good things, but they're definitely more limited in what they can do because of the massive structure that they have to do. And we are doing our best to grow and try to change that, but we're not going to compromise quality for quantity. That attention to detail is of utmost importance to us. It's so much easier to come to a place like this where you have people who care about your treatment, care about you as a human, not just as a patient or a number or an insurance bill. We care about you as a person, and I take pride in the fact that I like to get to know people and understand who you are, and that honestly helps me to guide your therapy as well, not just because I like to have friends, which I do, and I like to be friends with my patients, but it helps me guide your therapy. What are your goals? And I need to understand that for me to be able to make a treatment protocol that's gonna work for you. So I believe in what we're doing here because I've seen it work.